তো দর্শক আমি আজকে খুব সৌভাগ্যবান যে আজকে আমাদের অনারেবল হেলথ মিনিস্টারকে পেয়েছি মার্ক হল্যান্ড। আমরা ওনার কাছ থেকে কিছু কথা শুনবো কিভাবে ইমিগ্রেশন সিস্টেমে আমরা আরো হেলথ কেয়ার ওয়ার্কারদেরকে আউটসাইড কানাডা থেকে নিয়ে আসতে পারি কানাডাতে। সো অনারেবল মিনিস্টার মার্ক, I'd like to ask a few questions, and the first question is: we all know that in Canada we have a shortage of doctors and healthcare professionals. So I'd like to know what is the plan for Canada, what they're gonna do to fill this gap, to bring more doctors or nurses in our healthcare system.
Well, the great news is we're already making really good progress. We've signed deals with every province, every territory. We have $200 billion we're putting into the health system over the next 10 years. And so we just got the baseline data from CIHI, which is the agency that monitors data that shows nearly every province and every territory we have more doctors and more nurses. So we are expanding every year. And now the work that's in front of us is really a multitude. The first is to expand the people that are coming out of our colleges and our universities, to make sure that the seats to fill the positions, to make sure as well that we're using immigration to bring people who want to come to Canada to help be part of that solution. We've done tremendous transformative work to recognize foreign credentials here in Canada to bring these to bear. And we're also reducing administrative burden and making the jobs of health professionals easier so they can spend more time taking care of patients and less time doing paperwork. So there's a whole lot of things, and the net result of that is going to mean that we have the folks we need to deliver care.
Correct. And you may, not sure you are aware of it, the foreign graduate, foreign trained doctor from outside Canada, when they come here, they face lots of difficulties due to the complex procedure to become a doctor in Canada. So do you have anything in mind to make this process easy and less complex for foreign doctors to be here doctors so easily?
Absolutely. So one of the things that we've done looking with the colleges of physicians and surgeons is to take the wait time to recognize foreign credentials down from, in many cases, months and months and months and months, even over a year, to get that down to weeks, right? And so to really make that quick. The second thing is to be able to make sure that in the provinces and the territories that if you aren't able to become a doctor yet, while you're waiting for your credentials to be recognized, that you can be a health assistant and working within the health system, so that you're working and getting paid in the healthcare system while you're waiting for those credentials to be recognized. So we have some provinces that are doing a great job with that. We want all provinces to be doing a great job with that. And writ large, just making the practice-ready assessment process easier and simpler to use. So across the board, we're seeing huge gains and progress in that area.
That is so awesome. My last question is about the residency. So when a foreign trained doctor come in Canada, they go through a complex process that takes around a couple of years. So when they finally pass all those few exams, final step is residency, which is internship. And more than 90% of them, they don't get it at the end. So they end up with an Uber driver or a security guard, from my experience that I'm telling you. Do you have anything planned in your mind or to make sure they get the residency after they pass all those exams?
100%. So, I mean, this is really the provinces and the territories that you're talking about, but we can't afford not to have folks working in our health system. The health workforce needs we have are huge. And when we connect people to primary care, make sure they get the prevention to identify something before it becomes serious, identify something before it becomes a major chronic disease or illness or winds up in the hospital, that is not just good for them, it's good for our health system.
Right.
So really pushing provinces to make sure that those credentials are, you know, for somebody who's completed their education and now completed or entering a residency, make sure they have a job, make sure that they're integrated into our system. That's something we're fully committed to.
Thank you so much. There are thousands and millions of doctors outside Canada, those who want to come in Canada. Do you like to say something for them to encourage them to come in Canada?
We want you to come to Canada for sure. This is a wonderful place to live and to work. We have an incredible health workforce here already, people you work alongside of. And so encourage folks to come to Canada. It's a beautiful country and help make a contribution to make our country even better.
Thank you so much for your few words.
Thanks so
Really
much. Appreciate it. Thank you.